During today's session, we will be talking about pressure ulcers in the nursing home population. The CDC reports that 1 in 10 nursing home residents will develop pressure ulcers. These wounds are a significant issue because many elderly residents have limited mobility, making them prone to developing these skin breakdowns due to prolonged pressure on the same areas of their body. Pressure ulcers can lead to serious complications like infection and tissue damage if not properly managed. Many nursing home residents may not be able to communicate discomfort or reposition themselves effectively, putting them at high risk for developing these skin breakdowns. Today's session objectives are 2. 1. Understand the physical, emotional, and financial impacts of pressure ulcers. 2. Identify the causes of pressure ulcers and their different stages. 3. Describe the importance of early detection and intervention to prevent further complications. 4. Discuss preventative practices to eliminate development of pressure ulcers. When a nursing home resident develops a pressure ulcer, it can have a significant impact on the individual's overall quality of life. Pressure ulcers take a toll on residents from both a physical and an emotional perspective. Some of the physical impacts are pain. Pressure ulcers can be very painful, especially when moving or applying dressings, which can limit mobility and daily activities. Infection. Open wounds from pressure ulcers are susceptible to infection, which can further complicate treatment and potentially become life-threatening in vulnerable individuals. Tissue damage. Severe pressure ulcers can damage underlying muscle and bone tissue, leading to further complications. Reduced mobility. Pain and discomfort from pressure ulcers can significantly limit a resident's ability to move around freely, impacting their independence. Some of the emotional impacts are embarrassment and humiliation. The visible nature of pressure ulcers can lead to feelings of shame and discomfort, especially when needing assistance with care. Social isolation. Due to the stigma associated with pressure ulcers, residents may withdraw from social interactions, feeling isolated and lonely. Loss of autonomy. The need for constant care related to pressure ulcer management can lead to a feeling of dependence and loss of control over one's life. Anxiety and depression. The physical pain, social stigma, and dependence associated with pressure ulcers can contribute to the development of anxiety and depression. Negative body image. The presence of a wound on one's body can negatively impact self-perception and body image. Each resident will cope differently with the challenges of living with a pressure ulcer, depending on their personality and support system. Providing compassionate care, open communication, and addressing the emotional needs of the resident with a pressure ulcer is crucial. Pressure ulcer development in nursing home residents is a major financial burden due to direct treatment costs. The cost of dressings and supplies needed to manage pressure ulcers can be substantial, especially for advanced stages of wounds. Medications, specialized equipment like pressure-relieving mattresses, and wound vacs are also expensive. Increased healthcare utilization. Residents with pressure ulcers may require more frequent physician visits, additional nursing care, and potential surgeries to treat complications, leading to higher overall healthcare expenses. Legal costs. Nursing homes can face legal liabilities if pressure ulcers are considered preventable or poorly managed, resulting in lawsuits and settlements. Pressure ulcers also incur a time cost through staffing demands. Dedicated nursing staff time is needed for frequent repositioning of at-risk residents, wound care procedures, and monitoring the progression of pressure ulcers. Increased workload for caregivers. Managing pressure ulcers can significantly add to the workload of nurses and aides, potentially impacting their ability to provide care to other residents. Reduce staff efficiency. Time spent addressing pressure ulcers can take away from time that could be used for other important resident care activities. If severe pressure ulcers can lead to complications like infection, prolonged hospital stays, and increased mortality, further escalating the financial and time costs involved. Pressure ulcers develop due to constant pressure or friction on the skin that produces damage. This can happen when the skin is pressed against a hard surface, like a bed or chair, for an extended period. The pressure reduces blood flow to the area, which causes the skin to die and break down. Some factors that can increase the risk of developing pressure ulcers include immobility. If a resident can't move around, their body weight is constantly on the same areas of skin. This can happen if they're in a wheelchair, bedridden, or have a spinal cord injury. Age: older people are more likely to develop pressure ulcers because their skin is thinner and more delicate. Friction: friction can rub off the top layer of skin and damage blood vessels. Skin conditions: if the resident's skin is thin, fragile, or broken, it's more likely to develop a pressure ulcer. Moisture can also be present from sweating. Sensation: if the resident has decreased feeling in an area of their body, they're at higher risk. Incontinence: if the resident has urinary or fecal incontinence, their skin is more likely to become irritated and damaged. Pressure ulcers have 4 distinct stages that are categorized by symptom severity. Stage 1. The skin is reddened, painful, and warm or cool to the touch, but it doesn't turn white when pressed. Stage 2. The skin breaks open and forms an open sore or blister. The area around the sore may be red and irritated. Stage 3. The sore deepens into a crater, and the tissue below the skin is damaged. You might be able to see body fat in the ulcer. Stage 4. The pressure ulcer extends into the muscle, tendon, or bone, and there's a high risk of infection. Pressure ulcers can develop quickly, sometimes in just a few hours, if there's prolonged pressure on the skin. Friction, moisture, and pulling on the skin can also lead to this condition. Early intervention with pressure ulcers is vital because it allows for prompt treatment to relieve pressure on the affected area, preventing the ulcer from worsening, developing infections, and potentially leading to more severe complications like tissue damage, bone infection, and even sepsis. Addressing a pressure ulcer early significantly increases the chances of successful healing and minimizes the risk of further complications. Key aspects of early intervention with pressure ulcers are: minimize tissue damage. When caught early, pressure ulcers are usually only superficial, affecting the top layers of skin, allowing for easier treatment and faster healing compared to deeper, more advanced stages. Reduce infection risk. Early detection and treatment can prevent the ulcer from becoming a site for bacterial growth, significantly lowering the risk of infection. Cost-effective care. Addressing pressure ulcers early often requires less intensive treatment, leading to lower healthcare costs compared to managing advanced stages. Improve quality of life. By preventing further progression of the ulcer, early intervention can minimize pain and discomfort for the patient, improving their overall quality of life. There are preventative practices that can be done to avoid pressure ulcer occurrence. Some of these key aspects include skin assessment. Regularly inspect the skin, particularly over bony prominences, for signs of redness, warmth, or skin breakdown, which could indicate early pressure ulcer development. Repositioning. Change positions frequently, at least every 2 hours while lying down, and every hour while seated to distribute pressure evenly and avoid prolonged pressure on one area. Support surfaces. Utilize specialized mattresses, cushions, and overlays designed to redistribute pressure and reduce pressure points. Hygiene practices. Cleanse skin regularly with mild soap and warm water, especially after incontinence episodes. Dry skin thoroughly, particularly in skin folds. Apply moisturizing creams to prevent dryness, but avoid excessive moisture buildup. Nutrition and hydration. Ensure adequate protein intake to support tissue repair. Encourage fluid intake to maintain proper hydration. Mobility and exercise. Promote movement and exercise as tolerated to improve blood circulation and reduce pressure points. If unable to move independently, provide gentle range of motion exercises. Clothing management. Choose clothing that fits well and is wrinkle-free to avoid skin irritation. Avoid tight clothing or clothing with seams that could rub against the skin. Toileting schedule. Ensure timely bathroom breaks, which minimizes the amount of time a resident spends sitting or lying in a soiled surface. Implement plans to address incontinence. Managing moisture. Use incontinence products appropriately to keep skin dry and prevent moisture-related skin damage. Patient education. Teach patients and caregivers about pressure ulcer risk factors and prevention strategies. Encourage prompt reporting of any skin concern. It's essential to regularly assess patients' risk factors, including mobility limitations, nutritional status, and skin condition. Each resident should also have an individualized care plan based on their specific needs and risk factors. Finally, work closely with members of the nursing home team, including nurses, physical therapists, and dietitians, to manage pressure ulcer prevention. Key takeaways. Pressure ulcers have a negative impact on resident quality of life. Pressure ulcers have a high time and financial cost. Nursing home resident risk factors for developing pressure ulcers should be assessed frequently. Early detection and intervention will help reduce severity. Preventive practices can limit or even eliminate occurrence. Here are our references. Thank you for listening to this presentation.